So I'm sorry, so they have to not be breathing.
So again, you guys.
Good morning. I am Dr. Carol Rattay. I'm the Director for Delaware's Division of Public Health. And we are here this morning at St. Peter's Church in Newcastle for Attack Addiction's 5K run, which is really a rally of thousands of people coming together to come together around the addiction crisis. We are here at the facility to do our best to get naloxone in the hands of as many people as possible who may need naloxone to reverse an overdose. You know, unfortunately, we are seeing an increased number of deaths in our state related to opioid overdoses. In fact, this past year, it looks like over 400 Delawareans have tragically lost their lives to naloxone. About 400 individuals have lost their lives to opioids. Naloxone is a reversal medication that can reverse overdose. Of those individuals who have died, something that we also know is most of these deaths happen in a residence or in an individual's home, and many occur when there is no naloxone available. So probably 9 out of 10 are occurring where there's no naloxone available. And so for us in public health and in the Department of Health and Social Services, our highest priority right now is getting naloxone into the hands of anyone who may need it, anyone who may encounter an individual who has had an overdose. And this could be somebody who works with individuals like a librarian, or who connects with the public in that way. But individuals who may have a friend or a family member who's struggling with really any kind of addiction at this point should get naloxone, should have naloxone on hand. And so what we're doing here today is we have over 800 doses of naloxone available. And actually, I should say over 800 naloxone kits available, meaning 800 individuals can come through and get quick training, learn how to download the naloxone app, and leave with a naloxone kit. And we are so hoping that we can reverse our tragic overdose death rates by getting the naloxone in the hands of more people. I want to show you the kit so you can see what people are getting. First of all, it looks like this opioid rescue kit. And it has a number of important pieces of information in here. One is just to keep with you information about how to administer naloxone. But very importantly, and I'm going to have Kate come up in just a minute and show you about the new app we have called Opie Rescue, but we're really happy now to have an app people can download on their phones so that if they are in a situation of an overdose, which is obviously a very stressful, scary situation for people, they can just open the app and it will talk them through how to deal with the situation. The naloxone that we're giving out looks like this, so we're giving out 2 doses. And what people will learn how to do is to learn how to get that naloxone ready if they ever need it, which involves removing this cap and putting this on it, which just fits right in the nose. And then they learn how to take this off, push this up here, and then just spray it up the nose. And this is, it's as easy as that, and it saves many lives when it is used. In fact, we have over 3,000 incidents last year where naloxone was given, and that means that many lives are already being saved by naloxone being available. So Kate, can you come on up here and show folks how to use the naloxone app?
Yes, absolutely. So we have a Delaware specific app for overdose response. We created this and linked this to all of our Delaware resources, to our Delaware website, which is helpisherede.com. We also put a lot of resources on there, especially for Delaware pharmacies, where we can locate naloxone that's available with under the free under the standing order for naloxone. Unfortunately, it's not free, but we have a lot of events available in the community where we are trying to equip folks with the naloxone, just like today. But if needed, the pharmacies are another resource. So the app, we're hoping folks can download it and practice the steps of an overdose rescue. They can practice by following the instructions on here. We ask and encourage everybody to always call 911 in a situation of a overdose. But if needed to be, can be followed even without calling 911. It takes the individuals through each of the steps of the training that we teach here on how to administer support breathing, how to administer naloxone. There are currently 3 versions of naloxone available in Delaware, approved to use in Delaware. The one we're handing out today is the nasal kit with the atomizer. So if you click on that option, it tells you exactly how to put the syringe together, how to administer it. If you click on continue, it will tell you what to do after the naloxone is administered, what to watch for, how long to wait before possibly repeating the dose. And we always tell folks that the medicine is only good for 30 to 90 minutes, and that it is necessary to follow up with a medical care after the medication is administered. One of the main things that we are hoping to accomplish is to hear from folks who are doing these community rescues on whether or not their attempts are successful and helpful, and let us know how things turned out. So we incorporated this report reversal or report rescue feature in here. We're not asking for names, we're not asking for any identifiable information of the victims or any location information other than the zip code. We just would like to know whether or not the rescue was successful, not successful, where folks received the naloxone dose that they administered, and any other information that we are able to collect, so we know where to focus our efforts in the future. I will get out of this back to the main screen over here. Down here we have a feature to connect to our website, the Help Is Here website right here. It has a list of all the services in Delaware that are related to addiction prevention and treatment. We have the hotlines numbers available right here for both the Newcastle County and the Kent and Sussex counties, and what to do, who to contact. We have pretty much all the sections from our website listed on here. They are linked directly to the website. So any information that you are interested in, you can obtain that directly from the app. Last but not least, we have an invite button over here. If you would like to share this app with your loved ones, you can click on it. It will populate your contact list, and you can just click on invite. It will send an invitation to your friends to download the app on their phones as well. We hope you enjoyed the app. Thank you very much.
So I'm back, got distracted, lots of activity going on here, which is great. I want to mention something as to why this is so important right now. I already mentioned that we're losing a lot of lives in Delaware. This past year was the worst year, in history as far as lives lost from opioids. And the reality is fentanyl, which is a very, very powerful drug, is now found throughout our illicit drug supply. So in the past, people thought of fentanyl as just being in heroin, but now it's being mixed in with prescription pain relievers that are purchased on the street, cocaine, methamphetamine, and even marijuana. And so this is big reason, this is the reason why we are seeing such a huge increase in overdoses and overdose deaths. And this is why now, more than ever, it is so critical that as many people as possible have naloxone, so that when individuals accidentally overdose, which is really what's happening, they've got naloxone available. So as Kate mentioned, we have, if you go to OP Rescue, which anyone can download at this point, if you go to OP Rescue, you can find out where to get naloxone. So pharmacies across the state and any of our events, as well as Brandywine Counseling does training across the state. So lots of places where people can get it. I want people to make sure they know about Help Us Here. HelpUsHere.com has a tremendous amount. HelpUsHereDE.com has a tremendous amount of information about everything related to addiction prevention, treatments, and recovery resources, guidance for parents around prevention and identification, a lot of information for healthcare providers, but of course there's information about naloxone as well. So if you go to our website, helpusherede.com, you can find out a lot more about naloxone there as well. Want to make sure folks know that in addition to today, we have 3 additional events like this throughout March. So the next one is next Saturday, March 9th. It is from 10 to 2 at Deltec Owens in Georgetown. So for downstate folks, please consider going to Deltec Owens in Georgetown next Saturday. On March 20th, we also have an additional event, which is at 5:30 in the evening at the Dover Deltec. So please come to that event. But again, if those events don't work for you, please come to the website, helpusherede.com, or go to OP Rescue and find the places where you can get naloxone in our state. So again, we are here today at St. Peter's Church, and we will be here at least until 11. It's possible we'll be here longer, depending on the lines. But really want to encourage people, you don't have to be a part of the 5K to come and get naloxone today. So if you're anywhere near Newcastle and you think there is any possibility that you might ever need naloxone, please come over and do the quick training and get your naloxone kit. Thank you so much.